Good evening everyone. Warm greetings from HCG Suchirayu Tertiary Care Hospital Hubli. Me Megha Thakur, HR, would welcome our Managing Director and the leading most senior neurologist, Dr. Rajendra I Dugani. I welcome you, sir.
Hello.
So today we are going to discuss about the most seriously common topic seen nowadays, which is commonly called as paralysis and in medical terms called as stroke. So let's begin our question and answer session with Dr. Dugani. So would you please explain what is stroke?
Yes. Hello. Good evening, everyone. As she asked, let us start with a basic question. What is a stroke? The stroke is sudden loss of blood supply to the part of the brain. It's not the entire brain. The part of the brain loses the blood supply. If the entire brain loses the blood supply, if the patient becomes unconscious and he is called syncope.
Okay.
So it is not syncope and strokes are different. So the loss of blood supply to the part of the brain is called as a stroke. And it is sudden in onset. The term sudden is also equally important. How the accidents happen suddenly, the sudden is also important. So the stroke is also called, that is why, a cerebrovascular accident. Cerebrum is brain, vascular means the blood pipe. So accident in the brain blood pipe is the cerebrovascular accident. The brain, the stroke is also called as a brain attack. You must have heard the term heart attack.
Yes,
so
definitely.
the same, the brain attack and the heart attack, the process behind these two disorders is the same. The blood supply blockage to the part of the heart is called as a heart attack, and the same is the brain attack. So process behind both disorders is the same. So whenever a patient has a heart attack, the patient develops a severe chest pain. That's why he goes to the doctor. That's why the heart attack is so popular term in the general population. I wish even the brain attack becomes the popular in general population, because it can be recognized early and the treatment can be initiated. Whenever the patient develops this stroke, they develop half of the body weakness. That we commonly called as a paralysis, ardhangi vayu or a parshvayu. Stroke is a medical emergency. Stroke is a medical emergency, and it is very serious and devastating disease.
Yes, sir.
Yeah.
So why do you call it a serious and devastating disease?
Yes, stroke is a devastating disease because it is one of the leading cause of death and disability throughout the world. The data suggests it is the third common cause of death after the cancer and heart attack. The 25% of the people die within 30 days of the stroke. And another 25% of the people develop permanent disability, lifelong permanent disability. And you must have seen patients moving with hemiplegics, the paralysis patients who have restricted mobility, and many of the patients are bedridden.
Yes, sir.
And taking care of these patients is a big burden on the family. Another point is the cost of the taking care of this patient. So there is a social impact, there is a financial impact, and the worst is if the patient is an earning member of the family, there is again double impact on the family. So that's why with all these factors, it's a devastating disease. Another question you asked is how common it is.
Yes, how common.
Yes, it's one of the most common neurological disorder, and the data says the prevalence is 2 to 4 per thousand population. 2 to 4 per thousand population. If you put the same data in the time scale, every minute somebody develops a stroke in our country, and every 5 minutes somebody dies of a stroke. Such is the wide the magnitude of stroke problem in our country. And the worst part is, the bad news is, it's exponentially increasing. The incidence is exponentially increasing. In last 10 to 12 years, the incidence has become double. And the still worst is, these strokes are happening nowadays more and more common in the 30s and 40s. So you can imagine the impact of the stroke on the family and the other aspects.
So would you just explain us, like, is stroke a single entity or are there any types? If there are types, then
I wanted to one more convey here is, you heard all these bad the news about the stroke.
Yes,
I wanted to one more, I simultaneously want to give a good news about the stroke is, it's a preventable. The stroke is preventable if the proper care is taken, and also the stroke is treatable if the patient is brought early to the hospital.
Yes, sir. So I was asking, sir, like, is it a single entity or are there any types in strokes?
Yeah, there are two types of strokes. Actually, there are arterial strokes and venous strokes. Today we are concentrating on the arterial strokes.
Okay.
In arterial strokes, again, there are two types: the ischemic stroke and the hemorrhagic strokes. Ischemic stroke is the more common, so almost 80% of the time it's a ischemic stroke, and the remaining 20% of the time it's a hemorrhagic stroke.
Hemorrhagic stroke. Okay.
So, what is the difference between these two? In ischemic stroke, it's a blockage of the blood pipe. So you see the artery which supplies to the brain, it gets blocked by the blood clot, or we also call it a thrombus,
Okay.
and that's how the blood supply to the brain is compromised. This is the ischemic stroke. In hemorrhagic stroke, it's a blood pipe which are usually the small 1 or 2 millimeter diameter small arteries in the brain. They get ruptured.
Okay.
There's bleeding in the brain. The common term you must have heard is a brain hemorrhage.
Yes.
So that's about 20%, and ischemic strokes is about 80%.
80%.
The types of the strokes. Then I want to convey one more type here is the TIA.
TIA.
TIA is a transient ischemic attack.
Okay.
This is something like a mini stroke, or it is the warning stroke.
Okay.
Mini stroke or warning
Warning
stroke.
stroke.
Here what happens, the patient gets transiently the neurological deficits. So whatever hemiparesis or the weakness of half the body, it is there for about few minutes or max 5 minutes, and then the symptoms wear off.
Okay.
Symptoms wear off. But this should be taken as dangerous as a stroke
A
itself,
normal stroke.
and should be approached to a doctor, and the proper treatment is taken care of. Because the patients with TIA, almost 30 to 35% of the patients of TIA develop strokes within a year, a major stroke within a year. So TIA should be viewed as serious as stroke.
As a normal stroke. So it's important that prevention is better
Yeah.
than cure.
Yeah.
So it's just a sign. Yes, sir. So as you said, ischemic stroke is about 80% common, right? Can you just tell us how does this occur, or what is this blood pipe blockage? What are the causes for it?
Yeah, I said the ischemic stroke happened because of the blockage of the blood. This blockage of the blood mainly happens because of the excess bad cholesterol in the blood.
Okay.
This is a very important point, excess bad cholesterol in the blood. What happens, this bad cholesterol goes on clogging in our blood pipes. Slowly it clogs our blood pipes, and this usually happens as a aging process.
Okay.
Normally also it happens as a aging process. Say at 70 and 80 years it becomes significant. But this can happen prematurely.
Okay.
This is actually in medical term we call it atherosclerosis, and this can happen prematurely at the age of 30s and 40s. So why it happens? It is mainly because the inner layer of the blood pipe, we call it the endothelium.
Okay.
We call it the endothelium, and when this endothelium is damaged by a certain factors like the uncontrolled hypertension, uncontrolled blood sugars like diabetes, and alcohol, tobacco in any form, high cholesterol, bad cholesterol, all these factors, they damage the endothelium, and this damaged endothelium, slowly the bad cholesterol gets accumulated, and there's a clogging, and over a period of time there's a bump is formed in the lumen of the artery,
Okay.
and it blocks the blood pipe.
Blood pipe.
But this, I told you, is a chronic slow process.
Yeah.
But why acute blockage, sudden blockage happens is when this over a period of time in the middle, this lumen or this bump of the fatty bump gets ruptured.
Okay.
It gets ruptured and becomes the rough. Usually normal blood supply, whenever is happening, the blood is not clotted because the endothelium is very smooth. But whenever it comes across with a rough area, the blood gets clotted acutely.
Okay.
So when this bump is very rough and ruptures, the blood clot happens acutely, and that's how the stroke happens, initial stroke.
Yes. So can you tell us what are the risk factors?
Yeah,
or
another
any-
point I wanted
Yeah.
to mention here is the whenever this blood clot happens, sometimes the blood clot gets dislodged.
Okay.
In that particular area, may get dislodged and moves forward in the smaller arteries and get blocked.
Okay.
So it is called embolization. This is also one type of stroke, embolic stroke we call.
Okay.
And sometimes if this clot is in the heart, from the heart it can go to the smaller arteries of the brain.
Brain.
This we call it as a cardioembolic stroke. So these are different types of strokes and the mechanism of these strokes.
Yes. So can you just tell us what are the risk factors involved in this clogging of the blood and rupture and all of that?
Yeah. Certain people are more prone for developing this stroke. So stroke factors I can mainly put into two groups. The first group is a non-modifiable risk factors and the modifiable risk factors. Non-modifiable, I mean where you don't have a full control.
Yeah.
You don't have full control, you cannot do it, it's a part of life. Like the age, the second is gender, and third is the ethnic group. Like age is people who are at 55 or above 55 are more prone for developing stroke.
Yes.
And passing of each decade, your risk becomes double. So that's about age. And in the gender is concerned, the males are more prone for the stroke than females. And ethnic group, the certain ethnic group in the or throughout the world are more prone for the strokes. Like Asian people and the Black Americans, African Americans are more prone for the development of the stroke. Then coming to the modifiable risk factors. The modifiable risk factors is very important where we have some control. And if you can take care, you can nullify these risk factors. So in modifiable risk factors, again I want to put them in the two groups. The one where people having certain pre-existing medical disease, and certain other group is the problems related to lifestyle issues, lifestyle problems. The problem, the pre-existing disease, I mean people who are having uncontrolled blood pressure, high blood pressure, uncontrolled diabetes, high blood sugars, and people who are having pre-existing heart disease, like heart attack with the blood clots. And second is valvular heart disease, we call. They have a valvular problem. And third with the problems with the heart beating, the rhythm of the heart, is disturbed. It's called atrial fibrillation. So these are the people who are having pre-existing health issues. The other group is people having lifestyle issues. In this, the very important point is they commonly called as type A personality. Type A personality, where people have the very anxious people with a lot of fear, a lot of stress, and they slowly develop. It becomes a chronic stress. Some amount of stress is essential. That's what the stress keeps you on toes. But the chronic excess stress is not good. You have an excess adrenaline level that leads to excess adrenaline levels in the blood, and it has a lot of side effects on your metabolism. It can cause excess blood sugar, it can cause high blood pressure, it can increase your beating of the heart, it's tachycardia. So all those metabolic issues will start. So type A personality is not good for it's one of the risk factors, and that can lead to the chronic stress and chronic disturbed mind can lead to addictions. Chronic lead to addictions, especially the tobacco. The tobacco in any form, tobacco smoking, tobacco chewing or gutka, all these are bad, and alcohol. So ultimately these two addictions, they end up with these addictions. And unhealthy food habits. Unhealthy food habits is a very common risk factor. Excess eating of the salt, excess eating of sugar, excess eating of fatty things, and a refined flour. Refined flour, maida, we call it. That's why I usually tell my patients the three white poisons, the sugar, salt, and maida should be avoided. Three white poisons. And excess eating of non-vegetarian food is also not good, especially the chicken and mutton. They have very high saturated fatty acids, and they are not good for the health. The next point is the physical inactivity. Especially in all these younger generations and school children, the physical inactivity is the major issue. They are just glued to all the gadgets.
True, sir.
The excess screen time. They don't go to the grounds. The outdoor play has become almost zero. The playgrounds are becoming
it's
extinct.
completely extinct.
So the lack of physical inactivity, over-added the strong bad food habits, ultimately leads to high cholesterol levels, bad cholesterol, LDL and VLDL we call, and this is a vicious cycle, and then ultimately lead to all these vascular risk factors and the stroke. And here I want to say one more point is the adequate rest. Adequate rest and the adequate sleep is equally important. We call the term, we commonly use the workaholics, the concept of workaholic, but the workaholic is not at the cost of health. So adequate rest and adequate sleeps are very important, and this is the time where your body heals. This is the time where the body heals and repairs. See, body is also like a machine. It needs a repair, it needs a healing. Like that, in sleep provides that healing and the the repair.
Yes.
So everyone should have 6 to 8 hours of good sleep, and that's how if you charge your mobile, then only it can work for next 15-18 hours.
Definitely.
So if you have a good sleep of 6 to 8 hours, you can work in the rest of the day very well.
We can be
You
charged
are
up for the next
You
day.
can charge for the next day.
Yes.
So these are modifiable and
Yeah,
the
non-modifiable.
non-modifiable risk factors for the stroke.
Yes, sir. So as a common man, how can we recognize that, okay, fine, this person is having stroke or we are having stroke?
Yes, very important. As I told you, that depending on which part of the brain is affected, the symptoms vary, the complaints vary. So the common complaints are the half body numbness or half body weakness.
Weakness.
They usually come either the face numbness or the arm numbness or the leg weakness or half of the body numbness or weakness, or even sensory symptoms like the paresthesia as we call, or you must have seen the patient saying jum jum sensation.
Yes,
They may
sir,
say hand jum jum,
Yeah,
or
yeah,
the
yeah.
half body is get jum jum sensation is there. So that's a symptom of acute stroke. Then the something related to speech, the sudden loss of speech. Here I want to stress one more point: is the sudden.
Yeah.
Is a
Sudden
slow
onset.
weakness happens to the body over a period of 1 week or so. It is not a stroke. It may be inside some other problems like a brain tumor or so many other diseases are there. In stroke, the symptoms should be sudden.
Okay.
So sudden onset, sudden weakness of the body, sudden numbness of the body, or sudden paresthesias, then sudden loss of speech, sudden loss of speech or a slurring of speech, or the difficulty in comprehending the speech, other speech, is also a symptom of stroke.
Symptoms.
Then coming to the eye, the sudden loss of vision, it can be a symptom of
A stroke.
stroke. Sudden blurring, sudden loss of vision, or a double vision also. There can be a stroke. And there are certain set of symptoms which are related to stroke of the backside of the brain. So those are acute, where person is totally normal, suddenly develops imbalance.
Yeah.
So sudden onset of imbalance, dizziness, vomiting, double vision, dysarthria we call it, difficulty in speaking. So these are all symptoms of the stroke happening in the backside of the brain. And this area we call it the temple of our area. There is temporal lobe, is called. If there's something happens here, they can suddenly develop the abnormal behavior
Okay.
or acute confusional states. So abnormal behavior of sudden onset and the acute confusional states can be a symptoms of acute strokes. So these are all different symptoms of acute strokes. And to recognize and to react immediately and come to the hospital, there is an acronym, a small acronym is made, a short form is called a FAST.
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 FAST. F stands for the facial drooping.
Okay.
Facial drooping. A stands for the arm weakness, and S for the speech.
Yeah.
Any problem with the speech, you should recognize. And T is the time. You should react fast.
Yeah.
That is the FAST. That's a modified one more acronym called FASTER.
Faster.
FASTER, where earlier the vision is not included and imbalance is not included. Here those two are also included.
E stands for
the FAST is the facial drooping, A is for the arm weakness, S here stands for the speech.
Okay.
It's for the stability, imbalance.
Stability, okay.
And T stands for the talking.
Talking.
And E stands for the eyes, where it was missed in earlier acronym. E stands for the eye, and R is for the react.
Reaction.
Suddenly you should react and come to the hospital immediately, take faster action. So these are the symptoms of the stroke.
As a common person, we can definitely recognize
Recognize
all
and bring
these.
the patients early to
Yes.
me. Yeah.
So as a neurologist, how would you diagnose this and confirm that a patient has stroke?
Yeah, whenever, as I elaborated all these symptoms, whenever you have these symptoms, you should recognize that you have a stroke, and the doctor also presumes that you have these strokes, and he does some certain neurological examination, and fairly a clinical diagnosis is made that you have a acute stroke. And now this should be confirmed by a test called brain scanning.
Okay.
So purpose of doing brain scanning is two. One is you have to confirm that he has a stroke, and second is, as I said earlier, which type of stroke.
Yeah.
Whether it is a ischemic stroke or whether it is a hemorrhagic stroke, because the treatment of these two are totally different. It's opposite, east-west. So recognizing that he has ischemic stroke or a hemorrhagic stroke is very, very vital.
Yes.
So we do either CT scanning, which rules out there is very sensitive for the hemorrhagic stroke.
Yes.
So it rules out the bleed, and you can, if it is not there, then you go ahead with the ischemic stroke treatment. The MRI is more preferable mainly because it detects the infarct, that the stroke, which the damage happens in the ischemic stroke. It can detect even in few minutes.
Okay.
And it also tells the duration of stroke.
Oh,
If somebody comes after 3 hours, 4 hours, or it may pass 6 hours have passed, that can be identified by the MRI's brain. So MRI is more sensitive than CT scan. But if the facilities are not available for MRI, you can go ahead with the CT scan and you can still treat the acute strokes. And simultaneously, you should do all other blood tests like blood sugar, electrolyte, sodium, potassium, and related with the kidneys and liver. The sugar determination is very important because low sugars, many patients come with low sugars, and symptoms of low sugars can mimic like stroke. We call it as stroke mimics.
Okay.
So you should immediately do a blood sugar levels and other things and see if they are abnormal and treated accordingly. If it is a hypoglycemia and the low sugar, then you not do all the scannings and all that. It just becomes you give a sugar and you will not right.
Yes.
Yes. So this is about the investigations and of the.
Yes. So, and would you just elaborate on the treatment of stroke?
Yes. The whole purpose of today's this one is how you treat a stroke.
Yes, definitely.
Yeah. The treatment of acute stroke is emergency, as I already stressed, and I want to put them into 4 or 5 headlines. One is the stabilization of the patient. As soon as the patient comes to the hospital, you stabilize the patient. Then second is giving a thrombolysis. The thrombolysis is the mainstay of the treatment. That we'll discuss it in a few minutes. Then third is the statins.
Okay.
You can do a prior one group is the blood thinners.
Okay.
So blood thinners like antiplatelets and anticoagulants. Then comes the statins. Then the taking care of his other risk factors.
Okay.
Other risk factors like high blood pressure, the high blood pressure, the sugars, and other problems like heart issues.
Okay.
Those should be taken also simultaneously. And the last and not the least is the physiotherapy, exercises, and rehabilitation. So coming first to the first group, where stabilization of the patient. When a patient comes, he may be of high blood pressure, his heart rhythm may be irregular, and very important point is stabilizing his breathing.
Okay.
So many patients can have the very serious breathing problem as a part of the stroke, and especially when patient omits as a symptom of stroke, he can aspirate this vomitus and have a serious breathing issues. And some of the patients can die because of aspiration. It's very important. So stabilizing the patient is very important. And simultaneously, you investigate the blood test and all that, and then you prepare him simultaneously for the thrombolysis. So what is thrombolysis? Thrombolysis is the medicine which is available in last 10 to 12 years, and we are using in our hospital since last 4 to 5 years very regularly. This is the clot bursting medicine.
Okay.
This is the clot bursting medicine. And there are 2 types. One is the TPA, tissue plasminogen activator, and another one is tenecteplase. Both are good. And when this is given into that blood vessel, we usually give it in the injection form in the intravenous, and it dissolves the blood clot. Wherever the blood clot is formed, it dissolves the blood clot and the circulation is re-established. Blood circulation is re-established. Provided this is given within 4.5 hours time. This time is very important.
Time is
very important. But why 4.5 hours? I'll tell you. Whenever the blood pipe gets blocked, the core brain tissue, the damages happen irreversibly.
Okay.
That we call it as an infarct. But surrounding this infarct, there is an area which is non-functioning, but it's still viable.
Okay.
There's quite a good amount of brain tissue which is viable but non-functional. So this is the target of our treatment.
Okay.
Because what happens once a stroke happens, the stroke damage unfolds over 5 to 6 hours. It's not 100% damage at the onset.
Yeah.
As against in the hemorrhagic stroke. In hemorrhagic stroke, the damage happens 100% at the onset.
Okay.
But in ischemic stroke, the damage gets unfolded by in 5 to 6 hours.
Okay.
This is your window of opportunity. This is a golden hour.
Golden hour.
Where if you give this thrombolytic therapy within this 4.5 hours, that whatever we call it the ischemic penumbra, the medical term is the ischemic penumbra, those cells can be made viable.
Okay.
Made viable. See, every minute you delay, the outcome is worst.
Yeah.
Every minute, the damage of 2 millions of blood cells. You are losing 2 millions of blood cells every minute.
2 million.
So every minute is important. That's why the term is coined, the time is the brain.
Time is brain.
Time is brain. That's the term is coined. So each minute is equally important. So thrombolysis should be given within this 4.5 hours, and the recovery is excellent in those patients.
Okay.
Then coming to the another group of drugs is the
Blood thinners.
blood thinners. The blood thinners are two groups: antiplatelets and anticoagulants. Antiplatelets, the examples like aspirin, clopidogrel, and these are the drugs. They don't dissolve the clot, but they prevent the clot formation. They prevent the clot formation, prevent the progression of the clot. So the antiplatelets are usually given, aspirin and clopidogrel. They are given usually on the second day of thrombolysis.
Okay.
The first day, they are not given in the first day. First day thrombolysis, second day we start these antiplatelets. And they are given a pretty long time. And the anticoagulants are a special groups where they are given to a specific patients, like example, pre-existing heart disease.
Okay.
Patients who are having a pre-existing heart disease like heart attack with a clot, or people having valvular heart disease, and people having the problem with the rhythm like atrial fibrillation. These are the patients who need anticoagulants, like example warfarin we call the newer things are dabigatran. These anticoagulants are given in these group of patients for a pretty long, lifelong you can say.
Okay.
So next comes the statins. Statins have the group of drugs where they reduce the blood lipids, the blood fatty, bad fat I call
Like
so they
cholesterol,
like LDL and VLDL. And not only that, they have a positive effect on the blood circulation, positive effect on that fatty plaque. So people usually think my cholesterol is normal, why you are getting statins?
Yes.
No, it has additional effects like softening the clot, that clot or the plaque, and positive effect on the blood circulation. So statin is the important group of acute stroke treatment. And as I said, the correction of the things like blood pressure, diabetes, and all those
Sugar
things.
and all of that.
Yeah.
So this
The last but not the least, I told you, is the physiotherapy. Everyone says they just come and move my limb, why the physiotherapy is required. But physiotherapy is very essential, and physiotherapy given it should be started as early as possible once the patient is stable. Patient has to be stable to start the physiotherapy. And once the patient is stable, we can start the physiotherapy, and till given for about maybe few weeks to few months till the patient gets better.
Yes. So it was very informative, sir, in depth about everything. So as you said, there are two different types, right? Modifiers and non-modifiers. Since you said the modifiers are one which are under our control. So can you give us some tips about lifestyle modifications wherein we can prevent stroke?
Yeah, you're asking me how to prevent stroke.
Yes, sir.
How to prevent stroke. Yeah, this is very important. You can prevent stroke. As I told in the beginning itself, you can prevent stroke.
That was the good news of the topic.
But in this three things, one is the main thing is the modifying your lifestyle.
Yes.
Modification of the lifestyle is the main crux of prevention. Then second is quit your bad habits.
Yeah.
Quit your bad habits like smoking, tobacco and all that. Then third is take medicines regularly. So first, the important point is the changing the lifestyle. Keep your mind calm and quiet. It is very essential. Don't be, as I said, at the cost of the health. So changing your lifestyle, keeping the mind composed, manage your stress.
Stress
Especially, I want to give a tip to our viewers. The things like yoga, things like breathing techniques like pranayama and meditation, they can make wonder. So the key to happy life is the having control over your mind.
Yes.
And for this, yoga, meditation and pranayama are very helpful. Practicing them regularly, not doing once and beginning.
Yes.
Practicing them regularly, you can definitely you can handle your mind better. And in turn, you can have the control of all your lifestyle, and you can control your risk factors for the stroke or any other disease like, as I told you in the beginning, it's not only the heart attack, it's not only the brain attack. You can prevent the heart with the same background.
Yeah.
You can prevent many diseases. See, tobacco, for example, can cause cancer also.
Yeah.
So by modifying all these, you can prevent so many diseases other than stroke.
Yes.
And having adequate sleep, doing exercises is very important.
Physical
Doing exercises regularly, at least 45 minutes of exercise every day. The exercise means not that you're going to gym.
Yes.
Even a simple brisk walking. Simple brisk walking is enough for half an hour to 45 minutes. Is very essential and has a lot of positive effect on the body.
Yes.
And definitely the quitting the bad habits, having good, follow healthy food,
diet.
healthy diet is very important, and the taking regular medication is very important.
The ones
As I told you, once the risk factor I told you, the uncontrolled hypertension, uncontrolled diabetes. If you take your diabetic medicines, you take your regular BP medicines. So controlling these risk factors by taking regular medicine, and as I told you, even after the stroke, they have a risk of developing one more stroke. There is a colloquial saying, "One madra mood sarata."
Yeah.
Okay? So the 25% of the people who develop stroke have a risk of developing one more stroke in the near future, maybe within 1 or 2 years. They develop one more stroke if not taken proper care. Yes, I think this.
Yes. So coming to our last segment, can you suggest few tips or messages for our viewers today?
Yeah, I want to say the 3 key messages of today's talk. One is know that stroke is preventable.
Yes.
Know that stroke is treatable. So stroke is preventable and treatable. And know that stroke is emergency.
Yeah.
Stroke is an emergency.
As you said, it's sudden.
And there is a treatment available called thrombolysis. I've seen many patients, we say day-to-day practice, patient develops acute stroke, they go to the alternate treatment, like especially they go to Ayurvedic in so many in and around the places. So today's great message I want to convey to our viewers, as soon as you have an acute stroke, bring them to the hospital for the possible thrombolytic therapy. Every minute you save, you are saving your 20 lakhs of brain cells. Time is the brain. So time is the brain is my major today's key message, and definitely have a good lifestyle habits. And lifestyle habit, not that you start at the age of 40 or 50, बाद में देखेंगे, retire होने के बाद देखेंगे. ऐसे नहीं. These good habits should start from the childhood. Regular exercises, good food habits should start from a younger age group, from the childhood. Then only you can have the long-term
part of a life
and have a happy, peaceful, healthy life. Yes.
Thank you so much, sir.
Thank you. Wish you all the best.
So yes, so we have a couple of questions here as well. So is stroke a genetic disorder?
Partly yes. Stroke, if the person has a family history, if the father has developed a stroke in the past, or the mother has developed a stroke, or an elder brother has developed a stroke, it's partly, again, it is through the risk factors. See, like if your parents are diabetic, you are likely to develop diabetes, and diabetes is a risk factor for the stroke.
Yeah, true.
So indirectly, it can be, the answer is yes.
Yeah.
And there are certain very small percentage of patients, without all these risk factors, there are certain, say maybe 0.1% of people can have a family history of strokes, and they are more prone for the strokes as well as heart attacks. The answer is yes, but partly.
Yes. Any other questions? Yes. Yes, sir. So as you said, time is brain, and a sudden onset of stroke has a major impact on us. So as you said, sir, stroke is treatable as well as it is preventable. And when you keenly mentioned upon how time is very important, so you said an emergency department has to be well equipped, the ambulance has to be well equipped, the emergency has to be set very close to the scan centers and all. Scan facilities. So it is very difficult for an ordinary person. So I would like to convey to our viewers that Suchirayu Hospital is well equipped with all these facilities. The ambulance is well equipped. We have an ultimately extremely good ER team which manages any kind of strokes or any traumas on immediate basis with every different kind of departments from here. So as he said that, you know, having a scan center very close to the ER is important. So we have these facilities under Suchirayu.
Yeah, here I want to add a point.
Yes,
is we say the door to needle time.
Okay.
So whenever patient comes to a hospital with door, and till the time you give this thermolytic injection, the door to needle time has to be less than 1 hour.
Yeah.
Then only the effect is very measurable. And this is possible if we have a ready ER team.
Yes.
And the scan facility should be just by the side of the ER, emergency room. Otherwise, if the patient goes again for the scan center outside for the time is lost.
The time is lost. The golden hour is lost.
We in our hospital Suchirayu, we have a ready ER team, and just by the side of ER we have a scanning facility, even CT scan as well as MRI.
Yeah.
So the door to needle time in our hospital is less than 1 hour.
Yes. So the golden hour from 4.5 to 5 hours, what sir has mentioned, can be reduced to just 1 hour with the best facilities at Suchirayu. So I take pride to be a part of Suchirayu team, and I thank you very much sir for this wonderfully informative session.
Thank you.
Thank you.
All the good. Thank you.
Namaste.